Well, I believe, first of all, it's important not to lower your fees. The playing catch-up, if you're reducing your fees, trying to catch up from that is very challenging to do. So I don't think that practices should reduce their fees. I do believe it's important to continue to monitor fees and determine if increases are warranted. It's very possible that you won't make any changes to the price-sensitive services like vaccines or elective procedures, but I do think for the value-based services, the doctor's time and knowledge services, that we should still pay attention to those. And maybe we do more nominal increases than we have in the past, really nothing more than cost of living increases, and maybe we're even more selective about what we increase and what we don't, but I do think we have to continue to pay attention to fees. And maybe we do fee increases more frequently, in other words, quarterly instead of annually, and we do smaller increases. So those smaller incremental increases, I think, are easier for the staff members and the doctors to swallow, if you will. I think most clients don't notice the incremental increases. I think the practices are much more sensitive to that than what the clients are sometimes. When it comes to inventory, I think you have to be sure that if the vendors are increasing your expenses, your cost, that unfortunately has to be passed along to the client. So be sure that you're adjusting your inventory prices when the vendors adjust your cost. And then I think the last thing to really pay attention to when it comes to fees is continuing to look for opportunities to meet and or exceed the client's expectations. By that I mean just really be sure we've got that knock your socks off service. We're creating that wow factor, and that's what's going to keep clients coming back and willing to pay your fees, because they're getting that quality and that level of service and that level of engagement from you that they're seeking.